So in this video, I'm going to demonstrate how to insert a nasogastric tube and explain irrigation as well. So I've got my head right here, or my patient, I should say. And I would check the order and the medical record and check what type of NG tube is to be placed and what it's for, whether it's for suctioning or feeding. And then I would assess the client's NURs for patency and to make sure there's not a deviated septum, and choose the nostril that's best. Ask the patient if they've had surgery, look in their mouth as well. And also you would occlude NURs and ask them to breathe in and make sure there's normal breathing for the nose. Now, you want your supplies that you want to get are the irrigation tray with the piston syringe. You'll need the syringe out of there. The tube itself, lubricant for the end of the tube when you insert it, of course your pen light and gloves. And the next thing, and you want to have your tape ready. One piece of tape you want to have like pant legs on so you can wrap it around the tube, and then you want another piece for the bridge and another piece to mark on your tube where you need to stop. And you would figure that out by putting it on the patient's ear right here to the nose, or the nose to the ear, and then from that to the xiphoid process. And then you would place the tape so you know where you're going. And it's usually like 50 centimeters. So I'll put that right there. I don't want it to stick too good. Won't be able to get it off. Okay, and then you would apply your gloves. And this isn't a sterile technique, it's just a clean technique. But of course, with anything you want to be as clean as possible. And then explain to the client what you're about to do, and ask them to extend their head back against the pillow. And then of course the bed would be in a high Fowler's position, so they're like sitting up. And then you would curve the end point down towards the ear, and go ahead and, you have to put your lubricant on, of course. And then you start very slowly pushing it in. And then when you're about to the throat, you want to check, or a little past the throat, you want to check that it's not coiling in the back through the mouth. And then if there's resistance, you might be able to utilize a UAP or another nurse and have them give them water to swallow, unless they've got something like they're not able to swallow, and then of course you would just do dry swallowing, but they would swallow while you're pushing it in, and then they would put their chin to chest while you're going the rest of the way in. Hold on 1 second. I made a hole through here, so it's gonna, there we go. And then you would keep going until you get to your tape. Swallow, swallow, swallow. And then you're at where you had the tape, and you want to tape it down. I don't know if it'll stick to this. Oh, maybe it will. And then go. Okay. And then, of course, if any gagging or coughing occurs while you're doing it, you want to withdraw the tube a little bit and let the client rest, and then you would continue to advance again. And you want to ask the client to speak, make sure that they can speak, and inspect again to make sure that it's not coiling at the back of the throat. And then you've got 3 different ways to figure out if it's in place. One way that Dr. Hessel said is to push air in through the tube and then auscultate for the gurgling sounds, but from what I understand, that's not normal protocol anymore. So you would attach the tube, aspirate some stomach contents, and then do a pH strip. Or the best way to really look at placement is an x-ray. And then you would clearly fasten the rubber band to the end of the NG tube in a slip knot and pin it to the patient's gown, and now allowing for enough slack so that the patient can move their head around and still function normally. And then you would attach the tube to a suction source at low intermittent setting unless otherwise ordered. And then you would provide oral hygiene every 2 to 3 hours. Then you would document what you've done with all the appropriate documentation. Note the color and consistency of the drainage that you pulled out as well. And then if you want to irrigate, you would simply, take the tube off this suction and place it on the towel, and then you want to aspirate and then instill 30 milliliters of sterile water or normal saline and withdraw the solution, and then measure and discard the amount that was returned, and then reconnect the NG tube. And then, of course, document your irrigation. And that's it.